For now, health pundits here in the country believe Omicron will dominate local infections in the days ahead. I have Kim Yeon-seung back in the studio with details on that. Yeon-seung, welcome back.
Thank you for having me, Sunny.
Right then, let's begin with the implications of an Omicron onslaught on our daily tallies.
Right, so it's not looking good ahead. In a month's time, numbers could spike to between 10,000 and 15,000 a day if the country fails to contain the virus soon. With Korea marking Seollal, or Lunar New Year, just over a week from now, health authorities are bracing for a potential holiday surge fueled by large family gatherings and cross-country travel. Seollal is also expected to be a busy time for businesses, but many of them will be missing out on key sale opportunities with all the COVID-19 curbs in place. The government has earmarked 14 trillion Korean won, or $11 billion to help business owners navigate through the rough waters ahead. This budget, which is waiting a floor vote on the National Assembly, includes cash handouts of $2,500 to each business owner.
Right. Yeon-seung, now throughout this week, you've been talking about Omicron-tailored strategy by the government, right? Tell us a bit about that.
Right. So with the anticipated Omicron surge ahead, health authorities need to find the right answers to these three pressing questions. These are namely how they're going to speed up testing, maximize treatment using limited medical resources, and prevent imported cases.
Right, and on this Friday, Yeon-seung, I understand authorities shared intentions to those ends, right?
Yes, exactly. So to ramp up testing, the government will make rapid antigen self-test kits available free of charge at COVID-19 screening centers. Let's take a listen to Prime Minister Kim Yeon-seung on the rationale behind this decision.
PCR tests will be for high-risk groups only, so that'll speed up the process. Standing in long lines in this cold weather to get tested will become less frequent.
The government is also mobilizing local clinics for testing and treatment. These changes will first be applied on a trial basis in regions that are witnessing an alarming spread of Omicron. These measures will then be adopted nationwide if they prove to be a success.
Right. Yeon-seung, which regions are we talking about here?
Right, so throughout the week, I've mentioned Gwangju City and Seollal province have seen most of their cases as Omicron. So these areas will be included. Omicron is also spreading quickly in the southern region of Gyeonggi-do province, so namely the cities of Pyeongtaek and Ansong. The new testing and treatment measures will also be rolled out in these areas as well.
Right, and moving forward, Yeon-seung, what about border controls here in the country?
Health authorities are doing everything they can to strengthen border controls. On top of the PCR tests that all arrivals have to go through, rapid antigen testing will also be required to minimize the possibility of imported cases leading to a community-level outbreak. Strict isolation rules will also apply. Quarantine exemptions will only be granted on a very limited basis.
I see. I hear authorities are also planning to expand the use of Paxlovid in the country.
Right, so Pfizer's oral treatment Paxlovid has been cleared for people aged 60 and over. Let's take a listen to Prime Minister Kim from this morning for more details.
We're bringing down the minimum age of drug administration from 65 to 60 and expanding its use in nursing homes, care hospitals, and infectious disease hospitals.
Up until Thursday, only 109 people had received the pill since rollouts began last Friday. This is far short of the government's initial goal of prescribing the pill to 1,000 people a day from their stock of 21,000 courses. So with this latest move, authorities are really trying to ramp up the use of these COVID-19 pills.
Right, Yeon-seung, and what's the latest with regard to other alternatives, that is, for treatment here in the country?
Right, so health authorities are also expanding the use of remdesivir. Remdesivir is an antiviral medication, and on Friday, Korea's drug regulator approved the use of remdesivir on patients with mild to moderate symptoms of COVID-19 as well. This intravenous drug had been previously used to treat critically ill patients only, but health authorities are broadening the use to prevent mild cases to developing into severe illnesses. They felt confident enough to make this change after reviewing clinical trial data and also looking at the precedents set in Europe.
All right, Yeon-seung, thank you for now, but do stay with us for the broader talks.